Welcome everybody to the an exciting WHO Global Action Plan on Physical Activity webinar. This is a first joint webinar between two leading societies in the physical activity area, ISPAH and ISBNPA. Very excited to be having Fiona Bull, Professor Fiona Bull from the WHO, who's going to present on the Global Action Plan. And we also have, next slide, thanks Antonio. Sorry, I'll introduce the other participants in a moment, but just so that you know the webinar system, the participants are muted by default. So please write your questions on the Q&A box, and as soon as we have them, we'll answer the questions during the discussion. Fiona will present for about 20 minutes, so there'll be plenty of time within the hour for questions and answers. And you can raise your virtual hand during the discussion to interact verbally with the panellists. Thanks, Antonio. So, yes, this is an initiative to promote physical activity worldwide for adoption in May 2018. And the rationale is laid out and the opportunities for multi-sectoral actions for progress on what is obviously a key risk factor for non-communicable diseases, which is a major focus for the WHO. So the webinar content, Fiona will talk about the plan. There is plenty of opportunity for feedback, obviously today, but also there is a survey. We'll put up some details about links to the survey at the end of the webinar, and there'll also be lots of opportunities for questions and discussion today. So Professor Charlie Foster is the ISPAH President, and he's also going to help moderate and lead the discussion. So, and I'm Jo Salmon, the Past President for ISBNPA. So thank you everybody, and welcome to Fiona.
Well, thank you very much, everyone. I'm just going to open up my screen so that I can share with you the slides. And there we go. So first of all, good evening and good afternoon, and I think a very early good morning to some people who might be joining. This is a great opportunity, and I'd like to extend my thanks to both ISPAH and ISBNPA for coordinating the opportunity to share with you and introduce the draft Global Action Plan on Physical Activity. I'm hoping that many of you have heard about it, perhaps been following some of the Twitter feeds, and perhaps, I hope, also read the document itself. But for the next 20 minutes, I've got an opportunity to introduce you to the Global Action Plan. So the structure I'm going to take is provide a short background, but I think a useful one to put the Global Action Plan into a wider context and sort of set the scene for where the Global Action Plan fits in the NCD and physical activity agenda. Explain where the mandate came from very briefly, and of course spend most of my time on section 3 looking at the structure and contents of this to explain some of it to you in more detail, orientate you to you if you haven't fully explored it, and of course stimulate some discussion. And at the last section I'll just return to the opportunities for feedback and the whole consultation process. So setting the scene, and this is a busy slide, but I suspect for the audience that might be here today, quite familiar icons there of documents that are quite well known. But I've chosen to sort of situate this by looking back to a landmark document, 1996, and reminding us that it was landmark in its positioning of physical activity, the consensus document on the science, and of course setting new recommendations, which in the absence of WHO presenting global guidance, this really was the global statements. But you can see on the rest of the top row the sort of documents that have come out. Some years later, the first global strategy on diet, physical activity and health followed a couple of years later with a suite of materials aimed at helping countries start what works, a framework for monitoring and guidance on implementation. A couple more years later, we got the global guidelines that many of you might well have been involved in, as it built on the Canadian, UK and USA work in particular. And that's about the sum total of the physical activity documents, guidance, standards, recommendations from WHO. And I think we all know that actually it didn't lead to that catalytic role we thought they would and the change in physical activity actions. So the bottom row starts to show you some of the more recent and, of course, quite important landmark events and situate where this global action plan fits. 2011 UN meeting, NCDs become a global priority, stimulated the global action plan from WHO in 2013. That was partly under that umbrella that led to the global target you can see in the circular icon with our physical activity 10% reduction being part of a set of 9 voluntary goals which have been adopted by countries. And then the most recent opportunity, and that is to create the links with the new set of sustainable development goals. And there you have on the right hand side the opportunity that we've got now to present and develop the physical activity global action plan, building on perhaps a new landscape and context. You'll see that there's 3 little boxes there because it's not just an action plan. I will speak briefly to the opportunities we've got to develop a toolkit to help countries. And it's really the action plan and toolkit that on their own probably will be insufficient, because it's how we create a social movement, a global agenda, and get momentum around with countries, regions, and globally. And I'll come back to that and hope that stimulates some discussion. But outside of WHO, we've certainly not been quiet. And of course, civil society like ISPAH and ISBNPA have been busy collecting the science and trying to prompt and advocate for physical activity actions. And you see a slide here of some of the outputs from ISPAH, well-known outputs that have really supplemented the WHO by providing short, sharp recommendations, calling for action, and then providing 7 particular areas shown in the picture on the right, which cover the sectors that we know we've got interventions that can be effective in. And this has been useful, but it's not WHO's, it's the civil society with all the science that backs it, and is a good, useful tool. Complemented now most recently by the Bangkok Declaration. Again, I'm hoping most on this call might well know this. It's available from the ISPAH website. A particular focus of this was to pick up on that 2016 Global Sustainable Development Goals. And you can see a modified diagram there of the Sustainable Development Goals having particular leaves emphasised. And with careful consideration, the physical activity community has identified links, direct and indirect, to achieving 8 of the SDGs, not only health in the centre, but opportunities to link with each of the ones which are shown. And I've just got this next slide that articulates a little bit more clearly these opportunities, because it's through provision of good opportunities for physical activity that we can help with quality education, SDG 4. We can help with sustainable cities and communities, SDG 11. Through more cycling, we could reduce car use and help with climate change, SDG 13, etc. And the Bangkok Declaration outlined these links in more detail and been a valuable contribution. Science has continued, and I highlight here just a few but rather prominent developments over recent years, with Lancet special issues, physical activity in 2012 and 2016, looking at urban design, transport and health. And way back in 2004, one of the first calculations of how much the attributable risks for physical activity. So I think across this we can see the science, we can see the advocacy efforts, and we can see the starting point of WHO's response with the global strategy back in 2004. But I think many of you will share that we face some real issues, and this slide sort of summarises at least 2 large gaps. The evidence is strong, but we're still waiting to see and not seeing sufficient translation of that evidence into national policy and strategy. And of course, gap number 2, translation of that strategies in countries into implementation. So it's within this context that the Global Action Plan sort of surfaces and needs to make a substantive contribution. Global estimates, well, these are the latest data, though I draw your attention to the red comment at the top here that we are undertaking and will have soon new estimates on the global physical activity levels, which we will be inserting into later versions of this global action plan. But currently, familiar to many of you, the global levels of inactivity are 23%, 1 in 4 adults. But look at the regional variation, and of course, it hides country variation within region. So I'll show you in the next slide some of that variation. But of course, it's on the right-hand side that many of you have seen this slide before. As countries develop in economic and social development, moving from lower to middle to high income, levels of inactivity are increasing. And of course, the aspirations and directions are economic development, and we're seeing lower levels of activity in high income countries. Let me just show you what I was alluding to in terms of what's hidden behind that global average. And I've just selected here examples from countries in the East Mediterranean region, but levels of inactivity can reach 60–70%. And the patterns we all see frequently are females being less active than males. And progress is slow in that action, returning to that slide on gaps, where we see here in this slide, I've taken data from the WHO Country Capacity Survey, which asks countries about developing their policies on physical activity, and then in blue asks if those policies are operational. And there's a good news, bad news story here. You might be surprised to see the number of countries which actually report having a policy. There's no measure of quality here. It's just yes, no, have you got one? But then the yes, no of whether it's operational is showing nearly half of them, at least back in 2010, are reporting that they're not operational. Slight improvement by 2015. And you can see on the right-hand side that there will be 2017 data. So again, to recap, the science is strong, the advocacy work is calling out and trying to support the area, but still we have progress being slow at the countries. So it's within that context that we have a call by member states, as particularly leading countries like Thailand and others in the Southeast Asia region in particular, calling for a new global action plan. It came about via the Executive Board meeting back in January, and it requested that the World Health Organization support countries through developing a global action plan on physical activity, build on the previous strategies, link to the Sustainable Development Goals, and provide guidance to how countries should actually implement and tackle this growing epidemic. Here's an outline of the consultation and development process, and we're in the busy middle phase of that. As you glance down the centre of the slide, we've got regional consultations ongoing at the moment, and I'll speak to those later. Stakeholder-led consultations, I'm delighted to regard this as one of those initiatives where the stakeholders of the research community and the societies of ISPAH and ISBNPA, we have an open online consultation, which my closing slide will give you more details of, and we're including briefings to the permanent missions here in Geneva and reaching out to the UN agencies like UN Habitat, UNESCO, UNICEF, UNDP, etc. And here are the webinars. But prior to this, we're quite busy internally. And firstly, we had to establish an internal steering group. And I'm pleased to report to you that we've reached out to a lot of different departments: child health, ageing, environment, nutrition, road safety, as well as, of course, treatment and prevention of NCDs, to make sure that we communicate internally as well as externally. The broad sector involvement there was replicated in when we convened our technical advisory group, and ISPAH and ISBNPA were both represented on this technical advisory meeting that was held in July. And you can see the bar extending across the months of 2017 and 2018, because it's hoped that technical group may well take some leadership through the next few months and into 2018. Let me finish this slide by just drawing to the two red boxes, because they're the D-days. The deadline date is that the draft has to be revised following all the consultations of this summer by the 1st of October. So you can imagine a couple of weeks away, or 3 weeks away. And then we submit that to the Executive Board meeting in January, and then revisions take place before the World Health Assembly in 2018. We can come back to this slide if there's particular details. So let me turn to the substantive start. What is it? Why is it as it is? And what's inside it? So critically, it must build on the Global Action Plan, and I hope everyone's familiar with page 33, 34, because they are the outlined items which provide very large, broad statements of what countries were encouraged to do. And when you read them, you perhaps can see why they're very difficult to operationalise. They're quite dense and broad statements. But they are there, and we need to now take those and expand on them in the Global Action Plan and add any new science and new actions or policy recommendations. And of course, work within the umbrella of the global target of 2025. One of the things which also came out of the WHO Global Action Plan is a series of calculations and analyses of identifying the most cost-effective interventions. And I draw your attention to the most recent version of this document, and the source of the website on WHO is available at the bottom. They're known as best buys, and these were calculated for each of the risk factors. On physical activity to date, there's been 2 analyses of cost effectiveness of different interventions. And the first one was the cost effectiveness of mass media, mass communication efforts, and it proved to be very cost effective. The second intervention was brief interventions by primary healthcare professionals, and that proved to be cost effective. And so those 2 have particular feature because they have fallen into being cost effective for countries to consider. Of course, from a physical activity perspective, there's much work to be done on assessing through the WHO choice economic modelling other interventions, and that's an ongoing piece of work. But to date, we have these 2. So if I return, we must build in page 33 recommendations, the 2 best buys into the substance of what we create and expand it to reflect latest knowledge. In terms of commencing this piece of work, this slide perhaps captures many of the thoughts that were internal at WHO, I think reflecting also perhaps the messages that were in the Bangkok Declaration and much of the scientific community and the frustration that many share. But we need to address the lack of political interest. And so the aims and ambitions of this Global Action Plan are to present in a way, in a structure, something that can really restate and reignite a political interest and convert that interest into action and, of course, investment into physical activity in all countries. We need to really maximise the opportunities to engage other sectors, and I'm sure this is well understood by most on this call, that there is a need for and an opportunity for to work with other sectors, and they're listed there in terms of the environment, urban planning, transport, education, as well as with colleagues in health. And we certainly haven't yet achieved that. So how can this action plan engage other sectors as well as the health sector? Offer a short set of feasible policy actions is, of course, a must for such an action plan. And also address, under point 4, the reasons why countries are finding it difficult. The lack of surveillance data, the poor capacity for research and therefore lack of evidence in the local and regional context, capacity building in all sectors, and of course using innovation and technologies to improve the policy actions and practice. And lastly, I return to the point in the first slide I mentioned. How can we mobilise communities, mobilise professional communities as well as the lay community into recognising that physical activity is part of better health, better environments and better societies, and get a social movement? So there's no shortage of tall aspirations for what a global action plan might do. So when we developed it, there is a formula, and of course it's sort of shown here in a schema that the necessary parts are to make the case, part 1, provide some structure in terms of a vision, goal, principles and stakeholders in part 2. The core part is what are the actions and how to frame those, and part 4, linking to other resources and materials. And I've shown you in this slide the paragraphs which refer to each of these sections to help you if you're still getting to know the document. I'd like to go through each of these sections rather briefly, but stimulate perhaps any follow-up questions. The background, of course, just stays where we've come from, and I've just given you those in my first few slides. The mandate, I outlined that from the EB, and the structure. It's around 4 objectives and a set of actions which require multi-sectoral implementation. The situation is a large part in this draft document. I'd welcome comments on it, but each of the arguments presented in paragraphs 15 to 43 do actually make important points, certainly around the patterns of inactivity, the policy synergies, and that's where I refer back to the SDGs that the Bangkok Declaration started, but we must pick up in the Global Action Plan, the policy options, of which there are many when we start thinking about each of the sectors and the different types of physical activity, the costs of not acting, and the benefits of acting. Each has got the paragraph number there if you wish to critique the argument made and the examples given or the references given. The document makes the case that progress to date has been too slow, but we have the solutions and we know how to put together a successful package. A vision and a goal are presented. You can read this. I won't take time to read it out, but it states aspirational direction in which the Global Action Plan wishes all countries to aspire to. And there's a quantified metric for a goal. This has surprised many, expecting to see a 10% reduction in physical inactivity by 2025. But we've converted that into the actual count of people and wish to push that out to 2030. I'm sure there'll be much discussion about this one. The principles are listed. They are common to much of the work of WHO and public health principles in general, and I hope it's inclusive, but we welcome any omissions to be highlighted to us. The partners, again, I think fairly extensive. In the middle you can see the non-government, you can see the academic community, you can see philanthropic, and of course the other UN agencies in the second dot point. And this slide reminds me to introduce the idea that is present in the Global Action Plan, and that is to draw attention to the specific ways of being active. Physical activity is used as a term throughout, but at times the document speaks specifically to walking and cycling, sport, dance and play. These are the actual ways that we're physically active, and there may be advantages to speak to our intersectoral, multi-sectoral colleagues about the specific ways in which they can contribute. For example, in transport, they're most interested in walking and cycling, and the sports sector is most interested in active recreation and sport. And the play is important at all ages, but particularly in young people. So you'll see this, and we welcome comments to see whether this is a useful addition. And then the main substance, the 4 strategic objectives with short, catchy titles, here shown schematically. On the left, you see active people. On the right, you see active environments. At the top, you see building towards an active society. And at the centre, you see the need for us to change the systems that will support all of this to happen. Very briefly, we can start to see that each of them have a clear statement, comprehensive statement about its ambition, stating, for example, that in creating an active society, the aim is to create positive attitudes in communities and values towards being active, not only in the community, but in professionals as well. So that in fact, physical activity and the need to think about it in how we live and how we work is an important priority. Many would argue it's simply missing at the moment. Creating active environments, I think, will be familiar with many of you and underpins the fact that we cannot just provide the opportunities when environments are not supportive. Providing the opportunities is captured in the Objective 3. Opportunities of access to programs that support all ages, all abilities, diverse identities in different settings. And lastly, those systems. The research, the surveillance, the capacity building, leadership are captured here. In each of the 4 objectives, there are actions. And of course, the substance of the consultation is to invite you to consider the actions as well as the objectives and see if you can help us improve them, change them, find anything that's missing, or refine them. I'll very briefly go through this, but we'll be happy to turn to each slide in question time. But each one has 4 or 5. So you can see here in creating an active society, we need mass media community campaigns, community events that will engage people, strengthen the knowledge in other sectors about the roles in physical activity and walking, cycling, and have community-wide awareness of the multiple benefits of physical activity, not just to health, but to society and the environment. Creating the environment has 4 objectives, and I'll let you go through those. Creating active people is those programs and opportunities The first one is highlighting the role in schools of physical education. 3.2 is highlighting the role in primary healthcare. 3.3 is the worksite, community and early childcare. And 3.4 is making sure that we have specific efforts to reach out to the least active, the vulnerable and the marginalised, as well as putting all of that together in 3.5 for whole of community initiatives. And then lastly, the creating active systems. You can just scan down and keywords. The first one is leadership and governance, policy and guidelines. 4.2, research. 4.3, the data systems of surveillance and evaluation. 4.4, funding. 4.5, advocacy. And 4.6, strengthening professional and institutional capacity, the way they work, the priorities, the policies that they have in their institutions. So there we have it, the sort of the slimline picture, but you've seen now unfolded the multiple actions to achieve these 4 strategic objectives. In addition, we are obliged and required, and as we should do, to focus on how we'll monitor progress. How will we see if a country makes progress? How can we support and track and share lessons learned? So the indicators for each of these global strategic objectives are required. And this perhaps is the least well developed in the draft one that's been circulated, and as you can imagine, is somewhat dependent on the final actions that are chosen. But the preliminary indication is that we need indicators to sit within each of the objectives, reflecting the 4 actions. Where the monitoring and evaluation and progress will sit is in this shown in this slide, which is a complicated yet colourful summary of the multiple strands of evaluation, monitoring and progress reporting that's going on from WHO. Just look at the second line, because you see that being the Global Action Plan, and that's where countries are reporting on their progress towards implementation. But there are other important lines. The bottom line is that showing where they will report to the achievement and progress on sustainable development goals. One of the features of any evaluation of the Global Action Plan on physical activity is that it does not duplicate or burden too much with additional measures. So we're looking for capitalising on what's being measured already and adding to where we can within these systems. These systems you can follow up, because these are the kinds of outputs that are coming from those different ways, report cards on how countries are doing. So I just returned to this because we're still developing and welcome comments on the sorts of indicators, but they must be practical and feasible and preferably already being measured, but perhaps not reported against consistently in the terms of physical activity. So let me draw to a close with just a remark about part 4, and that will be the physical activity toolkit, because the Global Action Plan can't be the be-all and end-all. It can't do everything for everyone. So what's not in the Global Action Plan could well be followed up and be part of a toolkit, which might be a single document or a family of documents, and we welcome comments. Currently, some of you may have been aware of this at different conferences. There's been consultation on it, but we want to now align this draft physical activity package, toolkit and resources with the Global Action Plan. So we're not launching this because we're actually putting it on the back burner and wish to revisit and align it with the final Global Action Plan. But let me assure you that the intent is to have that coming out in 2018, not in 3 years' time. So let me finish by showing you the opportunities for consultation in addition to this call. We've already had a number of webinars, and there's links there to shorter and longer versions, with the one there from August. We're consulting with countries via regional consultations. We've just completed 2, and we have 3 more regions to cover. And I've mentioned we will be consulting with the UN agencies' permanent missions. We're absolutely delighted that the NCDA held a webinar, and there's a link to that 10-minute summary. And of course, today we've got this webinar unfolding. The key date for you all is that comments must be received via that email address by September 22nd, because our deadline is October 1st. So it's a very busy month for me and my team, with that deadline very much at the focus. Let me finish by showing you some photos for only a week old. I've just returned from Southeast Asia, where you can see a busy group of 8 to 9 countries from the region debating each section via a range of different techniques and discussions in country and small groups, and followed by the East Mediterranean region, where we had 14 countries present doing a similar workshop, sharing with us their thoughts and comments. And it's indeed the purpose of this call to invite comments and feedback. And here's a few suggestions, but it really is open entirely as a document for your comments so we can improve it. And I remind you of the ambitions. We need to change political focus on physical activity, engage our other sectors, and provide a short, sharp list of what countries can do and should do to create a more active society. Thank you very much. I'll be very keen to hear comments and questions. Back to you.
Fantastic. Thank you, Fiona, and perfect timing. I'd like to hand over to Charlie Foster now.
Okay, hi everybody, and first of all, let's say thank you very much to Fiona Bull for a fantastic presentation, and give all our thanks for her hard work and her team's hard work in producing this impressive action plan in a very short deadline to time and to scale, and giving us a chance now tonight to have a comment about it. We have a couple of questions, Fiona, as you've stimulated the audience, and particularly one from Amin. It was a great question about the 100 million active people target. Just about how is this calculated, and what are the proportions in relation to each country? So talk us through that, please.
Well, very briefly, it was an ambition to convert the percentage change that we need to see into some metric that we might be able to grasp, and ideally would be a nice big bold round number. It's a big bold round number, but it's not very easy to say. So the calculation is the 10% change in the current adult prevalence of physical inactivity, extended out to 2030 population, and then calculated backwards and rounded to make a round number. So you take the global population, 23% of them are inactive, take the population in 2030, we want a 10% relative change to 2010 data, and it's broadly 100 million. But your question is very important, and it's been a frequent remark in the consultations I just alluded to, because countries want to know what does it mean for them. So I think it's inevitable and desirable that we convert any large round into the percentage. But I invite comments and feedback via the various channels on what that percentage should be. If the 10% reduction by 2025 is already set, what is 2030? A couple more percentage, or is it bigger and bolder because we've really got the wheels turning and countries could accelerate to a higher, more ambitious number? So that's one idea, and of course then we'd need to have a evidence base for that projection. But other than putting 10% by 2025, the ballpark is open for what 2030 is, and we welcome suggestions. This was a first go. Thank you.
Okay, great, and thank you very much again, Amin, for your question. I appreciate you breaking the ice for us. A number of other questions have come through, Fiona, preceding the call as well. And there's a lot of discussion in the document about this thing called implementation. So I quizzed my students here today about what they thought that meant, and we got a variety of answers. So it would just be really helpful, perhaps, for all of us to have a kind of clear view about what you think implementation means and the challenge it has for us as a community of physical activity promoters.
Well, certainly the intent and use of the word within this context is about countries actually taking the policy action, which would be any one of the specific statements in the 4 strategic objectives, and doing it. In other words, taking their objective of the active people, with 3.1 or 3.2 recommending that the brief interventions, primary healthcare or physical activity should be integrated into primary and secondary healthcare, which requires a mechanism by which healthcare providers will be trained, skilled in assessing, recording and counselling briefly patients in the primary and secondary care. Implementation is countries taking on that action and putting it into practice. And what we have is recognition that that now is one of actually the best buys, but countries don't seem to get to the implementation stage. I say countries, of course there are examples. We have the UK, Finland and many other European countries in particular where efforts are being made, but worldwide and on a large scale, few countries would get a yes on that particular best buy. So that's my interpretation and the intent of the use of the word implementation in this plan. I'd argue that that's fairly standard, and I'm slightly perplexed as to what other implementation might mean. Back to you.
Okay, thanks, Fiona. Yes, I think they were overthinking it far too complex. I think it's very clear what it means. It's getting countries to do the things we know that are effective and make a difference. And of course, people start in different places, the countries as well. Yeah. You talked about your experience from two of the regions across WHO, from EMRO and from Southeast Asia. Were the reactions to the global plan similar or different? Did you see any nuances from these different areas?
Actually, between the two, it was remarkably similar. And the workshops were structured to allow all countries to really get to know the substantive content. In other words, the 4 objectives and all of the actions, which sum to an odd number of 19 at the moment, but the 19 actions. By looking at each one of them and thinking about whether they could do them, they undertook a little exercise of relevance and feasibility. And I don't know how quickly we could go back to one of my slides, but I'd be happy to do it if I've got the share screen, Antonio. But I could show you the little diagram which allows you to see at least one of the outputs. And that was how the countries looked at the issue of feasibility and relevance. Oh, blimey, excuse me. Let me just go, let me go this way. There. So I want to do that. So if I show you that middle slide there, a middle photograph, you can see a broad 3x3 diagram, and you can see on the bottom, very well, not so easy to see, but let me advise you that that's the relevance from low on the left, medium to high. So in terms of the actions, you can see the majority of the actions in this particular Objective 3, as it's titled, were seen as relevant, highly relevant to the countries. Where the difficulty comes is the feasibility. And so what then unfolded by the countries is telling us why can't they do these. And so I think we've got rich feedback from the countries on some of the reasons why it's only medium or low. But I'm delighted to point out to you the top right, where you can see it's the high, highly relevant, highly feasible. So we're using this technique to really get to know what the countries thought. There's a bit of coding going on there with colour stickers and the labels written there. We're in the middle of analysing all of that. And I can assure you, in fact, by just going to the previous slide, sorry, I've just gone the wrong way. Look on the top right. And again, slightly different, but you can start to see same matrix, a little bit more in the middle though, isn't there? A bit more medium relevance, medium feasibility. Now, what's interesting then is marrying up and looking at which of the actions across which of the objectives are situated where. So this is going to inform us, but I can assure you there's quite a substantive number of the actions that are in the Objective 3. More variability around Objective 2, and to remind you, that's the environment. So those environmental changes such as 2.1, building the walking and cycling infrastructure, 2.2, addressing the road safety, 2.3, I can't remember, but it's something to do with the implementing the right policies, prioritising the policies if I'm right. But countries start to divide on whether that's more feasible or not. And herein is the issue. They have to work with planning, transport and other sectors. And they're very much at the beginning of that. So there's one message that's loud and strong: help in working across the sectors, establishing, linking and working together. Okay,
thank you, Fiona. That's a very clear answer. And it's great to see the clustering of vision of what's feasible and deliverable as well. We've got another question in here from Daniela about the difference between where countries start from. So this question is, what is the starting point for a country that doesn't have a national physical activity action plan or an NCD strategy with people who have nothing really to begin with? But what should they start with? Where should they go?
That's a very good question, and it's one of the challenges that the action plan has, and most of our risk factor work does, that countries span the spectrum that the question alludes to, from the very beginning to my earlier comment about the UK, Finland and many European countries, which are certainly well advanced and with much capacity. Where the countries start, and I think what was shown there, is that most of the actions have some relevance. So let me pick up on the Best Buy again, the two that I alluded to, the mass media campaigns and the brief interventions in primary care. Both of them are relevant. It's just that countries at the very early stages are at the beginning of saying, how do we do this and how can we start? I would say that we know from most countries via the monitoring that's already underway that countries have a national policy. It was one of the requirements and commitments that countries made after the 2013, after the 2011 political declaration, part of the 2013 plan, and delivered by 2015. So remember the slide where I said which countries have got plans? And you might have been surprised to see how many countries have got plans. It's over 2/3, even 3/4 of countries. So there is a quarter of countries that don't have a plan. And of course, they're then saying, well, where do we start? But they can start, like many other countries have, with any one of the actions, and probably the Best Buys is a good place to start. What you might be alluding to, or what's certainly coming to my mind, is where in the document does it suggest that? That's sort of an interpretation that a country has to make rather than an explicit directive that the document provides for countries. And I'd welcome any feedback that you might have in how can the document guide countries as to where their entry point is. Those with experience might be able to analyse the entry point. How can we make that really easy for countries? Welcome your comments.
Okay, and that's a very good challenge, and certainly I know we talked about this, about certainly countries often have limited capacities, but sport often tends to be where people begin with, and you know, that may be a way forward. But I welcome again comments from our participants too. Fiona, you're on the spot here. I'm going to ask one more.
Shelley, there's another. Oh,
then it's yeah, Jo. We'll ask the question from Lucy, shall we?
Yes.
Okay, and then it's over to you, Jo, for a couple of your questions. So, question from Lucy here, Fiona. Yep. What sort of engagement and interest has there been from other non-health sectors, e.g. transport ministries, in the Global Action Plan?
Well, the consultation is open. I certainly can share with you the enthusiasm by which many in that community, certainly the professional associations that we reached out to and invited as part of the expert consultation and have continued to communicate with, have welcomed that we have reached across health into the transport sector. Obviously, consultation is open and we hope many of them will be responding, and I know several of them have. Leading agencies, whether they're advocates or scientific communities, are looking and welcoming that we are endorsing many of the same messages that they've been saying. So, of course, they want to increase walking and cycling. They would like to improve road safety. And so by way of one example, there is already recommendations on how road safety, through traffic calming, speed limitation, parking restrictions, can improve road safety for all users, in particularly walking and cycling. We're not reinventing the wheel here. We're actually saying that's part of our agenda. How can we work together to achieve it? But I do encourage us all to keep reaching out to transport, because it's mostly through the health sector. This document is going through the World Health Organization, but we are reaching out as much as we can and welcome you helping us. But I'm seeing quite a bit of response.
Great, thanks, Fiona. Okay, Jo, ball's yours. Over to you.
Thanks, Charlie. So there is a comment from Shana about the implementation, and I think I have a similar comment. I mean, you know, Australia is in the academic world is very, very active in physical activity research. You know, I think, you know, we certainly punch above our weight in terms of, you know, how many active researchers we have in this space, but our country still does not have a national physical activity plan, although they are starting to think about a national sports plan. And, you know, implementing it is a challenge. And part of that is not having a monitoring system. So I think governments like to keep their head in the sand. They prefer not to be weighed and measured because then they're exposed in terms of lack of progress. So is there another way that you know, as an academic sector and maybe even the WHO's role can put pressure on countries to actually take that next step, like almost naming and shaming? Is that it, or what's the way to go?
Oh, thank you. And I think your analysis is one which I share, and that is because we don't measure it and it's not then shared, countries can get away with statements in health plans and NCD plans and say, yes, we're doing something, when in fact they're not delivering on the details or the specific actions. Physical activity has suffered by not specifying the specific things which we wish to see. In contrast, the smoking tobacco field, of course, has made it very clear: smoke-free, taxation on cigarettes, restrictions on sponsorship and marketing, etc. And with a short set under a package known as Empower, they have held countries to account by constantly measuring those actions and reporting on them. And by doing that, that is the naming and shaming. We have a very strong case for the need to act, but I think it's part of this action plan, building on the work of civil society through the 7 investments and other documents. We have to agree on the short set of actions countries should be held account. So the 19 of them still sounds quite long, but I challenge us to see if there's any that could be deleted. How would we make the 19 9? Certainly no one in the recent consultations in CERO and EMRO did that. But no matter what the number is, it's a measuring and monitoring of those actions. Primary healthcare counselling, PE in schools, sports, providing sports for all and funding it, not just elite sport, walking and cycling infrastructure. These are the sorts of tangible things we know we want to see and we know are effective. We need to have them in a document like the Global Action Plan, in a monitoring framework, and then use multiple processes for accountability. The natural one is WHO asking countries to report via the World Health Assembly. But outside of the government structures, our civil society also monitoring, and you know the work done in the nutrition area, which is doing exactly that on nutrition policy, and tobacco does that as well, often referred to as shadow reporting, checking what countries say, checking their governments, and making a bit of noise about it when it doesn't add up.
Great, thank you. We've got a couple more questions that have come in. Anne has asked about how GAPPA can help countries to better organise or coordinate their policies, and maybe the clustering process that has been used in the consultation by WHO and regions could be integrated as a tool in the toolkit to help countries to prioritise.
Yes, yes. Excellent idea. I think one of the things I was very pleased about is that clustering activity, so that it starts to show us which ones country thinks are more feasible and relevant, so that they might well be the priority list. If there is a sort of where do we start question, well, certainly start on those that are most feasible and most relevant, because you need early wins, because one of the barriers is the short-term political cycle. How do you get money? Show success. So you can start to see that wins. Just to pick up on your earlier introduction to that question, we're hoping, and invite your own reaction and critique, that the document itself should be something that could be read by the other sectors. It could be a tool and a document that health, in a government, the focal point on NCD, risk factors, physical activity possibly, they can say, I need to go and talk to my colleagues in sport. I need to go and talk to my colleagues in transport. At the moment, there's no document that says that's what they should be doing, surprisingly. But this document from WHO would be saying that's exactly how we tackle physical inactivity.
And Barbara Jeffries, thank you, Fiona, for that answer. And I think that's a really important message for all of us for all the countries that are represented on the call today, at least. Barbara Jeffries has got a question about walking and cycling. And she said, would you consider having an indicator for the strategic objective 2 that specifically relates to an example about cycle networks and walking trails? The objective talks about walking and cycling, but it's not being measured here.
Yes, so we would welcome expertise and comments, experience of how can we quantify the provision of walking and cycling networks. Is it about pure quantity, or is there a quality measure? Our thinking is already pursuing the kinds of metrics that transport use for their own KPIs and internal monitoring on the level of service that's provided to the community in the road network. And here we're interested in the walking and cycling network. Are countries in their ministries of transport already measuring what tool could we use, but how can we quantify and qualify what a country's got now and how it could be tracked between now and 2030?
Great, thank you. I think, sorry, I've got one more question from Shana, and then I've got a question myself, which Charlie's doing a great job of prompting me. So Shana's asking about how can the action plan place greater responsibility onto health partners in investing into physical activity, which, as the evidence suggests, will contribute to improvement in wellbeing.
Could I just clarify, the health partners referring to whom?
Good question, Shane. I don't know if you want to provide any more. Oh, NHS. Health boards.
Health boards.
Yeah.
Well, I think, so we're I think the question is reminding us to look at our own health sector. And of course, we're asking other sectors to work on the pieces that they can contribute to, and health itself has much to do. Particularly, health should lead on coordinating the engagement of other sectors, lead on the mass media, public education where it should and can, and lead on the health sector interventions such as brief interventions. So how can we mobilise and get the political commitment and the ministerial priority towards physical activity? I think it's about this being loud and clear that they're cost effective. So this document is reinforcing the evidence around those, with the best buys underpinning it. And ministers were there at the World Health Assembly when they signed off that these are cost effective interventions. So now they'll be put and placed within this document on physical activity. But I still think it is that there's a role for the advocacy and the demonstration of success. We have too few examples of success, and so I don't think we are on the one hand listened to, because we're not noisy, we being the community of advocates for physical activity, and then where are we celebrating success to show that if you implement this, this is what can be achieved in how many years, and this is how many lives can be saved and health budgets can be reduced. And I think we have to gather those data, global, regional and country specific, and do a lot better at communicating them collectively and in countries.
Yeah, I agree. I think the more cost benefits, and we really need those health economists. It's critical to help our argument with government. So my question for you is where sedentary behaviour fits in all of this, and you know, it's not explicit, although there are some elements of reductions in sitting. So I just wondered about, you know, where that fits.
Yes, thank you, Jo. Certainly it's obvious it's not front and centre, and therefore there's an opportunity for feedback to give comments to WHO on whether it has been positioned sufficiently and in the appropriate place. The guidelines of WHO are more specific around the physical activity sign, although there is the recommendation to reduce sedentary time. And so it's referenced in terms of reducing, as you say, Jo, the inactivity and promoting all levels of activity. But it's not positioned as a strategic objective. It's embedded within the message of getting people moving and then more active from that. But I think we certainly welcome comments from both scientists and practitioners of how to position it within a document, bearing in mind the need to keep this simple and clear of what can be done in the evidence-based interventions. But the door and the floor is open for that feedback to come to us.
Great, thanks, Fiona. Charlie, I'm going to hand back to you.
Okay, thanks, Jo. And Fiona, you're doing a fantastic job. We're nearly there. You keep prompting questions. So we have another one from Erica here. She was referring back to the comment about government engagement and commitment at national level.
Yeah.
What kind of lever or mandate can WHO use or to help encourage governments to start taking physical activity seriously?
Well, there's no better one than a global action plan. So this in itself is the strongest lever that WHO has to create the mandate, which came through in January, to develop this tool, and then it needs to be followed up with some reporting back to WHO via countries, from countries, on how they're achieving. So certainly the need that this is not just a document that goes out, but in fact must be part of a cycle. And that's where that social mobilization and this movement that I referred to in the first slide and towards the end, this isn't just a one-time output. And if it is, it is doomed to have a probably small impact. We have to use it as a tool to create families of resources and materials and to leverage it. It might be surprising to you, but I'm already thinking about what do we do when we finish this, because the document in itself could and should be part of a mobilization. How can countries get involved with things? How can each country use this document? What is the actual action countries could be asked to do? People, advocates, scientific community, leading NGOs in countries, how can they advise their country on what they should do in 2018, so that within 12 months there is something, some things, it's more than one. For example, establishing champions. For some of the regions, they really need to invest in the research because there is no network, there's no research community. So I think there might be a potential for a whole suite of things, and different regions and countries might engage with one or other of these suggestions. But I think these are part of a platform of work that we've got to do in 2018 once we've got the document. The document in itself is the mandate for countries to implement it. And I welcome any suggestions that you have on how it can be used and should be used. First and foremost, my attention is on how do we make it look and feel readable and doable? Because if this looks too complicated, too difficult, or not clear, we've failed.
Okay, thank you, Fiona. That's a good challenge for us. Be clear about our asks, I think, is what you've been saying very clearly today, and the document reads well and helps with that. I know that with my ISPAH hat on, that we've been involved in the social movement in terms of the country cards and the GoPA report cards on countries, and the children's country cards that Canadians have been pushing forward. And these all make a case and make governments clear that actually they need to take action. And now we have some solutions that we can offer. Yeah. Well, the final question is, we have quite a good mixture of the two societies and interest in research and developing new researchers. So if I gave you a magic wand, Fiona, you could create a new cadre of young, enthusiastic research scientists in physical activity promotion. What would they be doing if you could spend your wish wisely?
Oh my goodness, that's an opportunity, Charlie. My wish is for all new researchers, young and old, to focus on demonstrating implementation, how to implement, and the results of that implementation. Take the practical solutions, take any one of the actions and say, we'll do this here and we'll show you how to do it. Bring your expertise in monitoring and evaluation, your time and effort and dedication to do what governments do very badly and without the resources to do it, to dedicate towards it. Evaluate your government's implementation. Offer to do that, get a PhD out of it, get excellent publications. But I think we all know from the international conferences of both these societies, there's too little evidence on scalable demonstration of implementation. We've got enough to get to where we are, but most countries would certainly say, show me where we've done it here or next door, not over there in another region.
Great, thanks. Sorry.
Go ahead.
say thanks Charlie, and thanks Fiona, and this is certainly something that you know, our societies are, I think, are increasingly recognising. ISBNPA now has an implementation special interest group, which is becoming very popular and well subscribed. So I think we're almost out of time now. So this session has been recorded. Antonio's very helpfully put up the links to surveys. I think there were still a couple of questions, but I please urge you to channel those questions into the survey, one of the survey links here that's on the screen. Make those responses prior to the 22nd of September so that Fiona and her group can have the I think unenviable task of compiling all those comments and feeding it back into the plan. But congratulations, Fiona. I think this is an amazing effort. Physical activity, I think, is much more complicated than smoking. Maybe I'm being unfair to people working in that area, but and I think that, you know, we are on the right track though, in terms of, at least if we're singing from the same song sheet and giving the same messages across the world to governments, eventually it'll start to seep in, and as scientists, how we need to measure the best way of doing that. So thank you again to everybody. Thanks, Fiona. Thanks, Charlie. And thank you to all the participants. And I hope you have a great evening and day ahead.
Thank you very much.
Thanks, Fiona. Thanks, Jo.
Okay.